Good afternoon, everybody. It's 4:30, so we'll get going. Hi, Commissioner. How are you? Thank you so much for joining.
How are you, Counselor?
I am well. I'm not sure we'll have too many folks on today, so we may have a short meeting today, but I really appreciate you taking the time. And I know we do have a couple members of the media on this afternoon. I see Counselor Govan is now joining as well. And so thanks to Matt and Paul for being here, and to our staff and Focus Springfield, and Counselor Hurst is also joining. So we'll go ahead and jump right in. I appreciate those that are able to be here today. And Commissioner, if you'd like to just start with any updates you'd like to provide. I know I did see that cases have gone down slightly, and I know we're in a better position with testing than we were when we were together 2 weeks ago, but I'll turn it over to you, and then we can just open it up for any questions from counselors.
Certainly. Thank you, Counselor Letterman. I appreciate your holding this meeting. Yes, as you said, the cases in the city of Springfield did go down by 402 cases, which is good news for us because we've been in this spike since November of 2021. And so to have the cases go down was just really good news this past week. Our hope is that the cases continue to go down. The age breakdown for the cases, and again, this data is up on the city's website. I think one of the trends that we're seeing and have seen over the last 3 to 4 weeks is that 0 to 10-year-old age group being the highest category of our data. So last week was no different. The 0 to 10-year-olds were 481. The 11 to 20-year-olds were 424, 21 to 30, 415, 31 to 40, 342, and then 41 to 50, 256. So you know that the majority of our cases are under the age of 50, 55.7% are under the age of 30, and 25.2% are under the age of 50. So we continue to see in our city that the under 30 group is the largest group we're seeing as far as positivity is concerned. Obviously, the concern for us is that that is the lowest vaccination group as well in our city. In the 0 to 10-year-old age group, obviously, under the age of 5, there is no vaccine. So having those numbers appear high is really somewhat not surprising, but certainly something that we hope we can trend in a positive direction. The cases, again, by week, we had Wednesday of last week was the highest, and that was 596 cases. Thursday, 453, Friday, 408, and then Saturday, 301. Again, this data is up on our website. The test kits, we have been, and I know Counselor Govan can tell you, based on what she saw at Indian Orchard, there continues to be a real desire to have the test kits. We did pass out test kits today at New North Citizens Council, the Department of Health and Human Services, and the South End Community Center. We will be in those 3 places again tomorrow, and the time is 10 to 2. And then on Thursday, we'll be at 16 Acres, Claudio Concepcion, and the Ray Jordan Center. And then on Friday, we are at Forest Park and Mason Square. And Saturday, we are at East Forest Park Library. The test kits, I know I work the East Forest Park Library, and we, at 1:30, those test kits were gone, and we had 900 of them. So it appears that our residents really do want the home test kits. The numbers that they're testing at Eastfield Mall have gone down. So we're not seeing that same level of angst around, just cars spilling out into Boston Road. They're still obviously doing testing, but the numbers have gone down. Now, if those numbers go down, that means that the numbers that we get in the city could potentially go down as well. The challenge we have right now is that people who are testing positive at home, there is no mechanism to report, or nor are our residents asked to report their positive test results to the Department of Health and Human Services or to the State Department of Public Health. So there could be positives out there that we have no idea about. What I'm giving you are the ones that come through the Department of Public Health. The mask mandate, as you know, is still in effect. It will remain in effect until the 1st of March, or the end of February, 1st of March. And then probably mid-February, looking at the numbers, we'll need to evaluate that decision as well. So those are the highlights from last week. And again, all of the data from all of the weeks are up on our website if you'd like to access them. Happy to answer any questions I can at this point.
Thank you so much, Commissioner. One question that I had was relative to the rapid test kits that folks are able to receive through the city. And I know there's also an option for folks to sign up for 4 test kits through the Postal Service, which I've been sharing with folks. I haven't heard from anybody who has received them yet, but I have heard from folks that have signed up. What do we know about and I say this because I think it's important for folks to have the info about the accuracy of the rapid tests and the sort of statements that have been made by the state at this point that, you know, the rapid test is appropriate as a diagnostic tool, that you don't necessarily have to go for a PCR if you get a positive rapid. You can use the rapid to say you are in fact positive and you should, you should quarantine. So can you speak to that a little bit for folks who are at home using these?
The State Department of Public Health is telling us that we have the iHealth rapid test kits. But in general, they're saying that home test kits are extremely accurate. And based on what they're seeing and their data, they have confidence in the results of the test kits that we are giving out to the public. So there's a high level of confidence that these test kits are accurate, the home test kits.
Okay. Councilor Hurst?
Thank you, Mr. Chair. And we did receive ours from the federal government, I believe, yesterday. So they certainly are coming in. Mr. Chair, question for you, Commissioner. Is there any guidance in terms of what it is that you're supposed to do if you test positive? Because, you know, if I had no idea, I'd imagine there probably are some other folks out there who had no idea. And I tested positive over the not winter break, but over the Christmas holiday. So, but I didn't know I was supposed to report. And to be honest with you, I probably wouldn't even have gotten tested because the symptoms were so mild. But since I did, who am I supposed to be reporting that to? And how do we know?
If it's a home test kit, there is no reporting requirement. So if you take that test at home, you can keep that information for yourself, and there is no requirement to report it. In the city, when we have a positive test result from a home kit, we are asking our employees to get a PCR so that we can verify that home test kits, because those individuals obviously will need to isolate. So the guidance is that you isolate for 5 days. After those 5 days, you can take a home test. If that home test is still positive, you will need to isolate for another 5 days. If that home kit is negative, you can put on a KN95 mask and go about your normal duties or your normal regimen that you might be engaged in. So that's the guidance right now. It's no longer a straight 10 days isolate. It is 5 days isolate test. And if it's negative, you can wear a mask, move forward. If it's positive, you need to isolate for another 5 days. I think we need to be clear about the difference between isolation and quarantine. So if an individual is positive, that is an isolation. They should stay away from other individuals. If an individual is around somebody or exposed to someone, then they are going to quarantine based on their test results. So isolation is for the source, the infected individual. Quarantine is for the exposed individuals. So that is the latest guidance as I know it, Councilor Hurst.
Got it. And are we handing out the KN95 masks?
Yes, we are. Today
Okay.
at the department, certainly we handed out KN95s to everyone who came to pick up a test kit. We did that as well at the sites that we're at. We will do that until our supplies run out. So we are giving them out as well.
Okay. Thank you. Thank you, Mr. Chair.
Thank you, Councilor Hurst. Commissioner, those KN95s that are being handed out, did the city purchase or collect those, or are those from a state distribution?
They are from the city of Springfield. We have not received allocations from the Commonwealth, but I think the state is waiting for the federal government to give us whatever that large shipment is going to be, those millions. And then I believe that DPH will then send them out to the local municipalities. But currently what we are using is what we have as a city entity.
Okay. And I was wondering also, I know that the schools, I know we had provided a pallet to the schools of rapid testing, and then I understood the state had also provided some more rapid tests. Do we know how that distribution has been going through the schools? And also, I know you had mentioned before that BHN was vaccinating through the schools. I was just looking at the dashboard, and so, you know, we can see that as of the 18th, 20% of the 5 to 11 population had received a first dose. I actually also saw 12 to 15-year-olds, actually 59% had received a first dose, which was impressive to me. But what are we hearing about those efforts in the schools?
The Springfield Public Schools are doing an excellent job. I spoke with Jeannie Clancy and AD early today. I meet with them once a week just so that we are all on the same page as far as the guidance that we're giving. And so I was told that they have vaccinated almost 600 students in Springfield Public Schools. Now, that may be, you know, folks may consider that a low number, but, you know, getting the permission slips back from the parents and then getting the vaccinations, there is a vaccination clinic that is being held at all of the elementary schools. And so we are working to get our students vaccinated. But to date, it's my understanding from my conversation today, 600 of our students have been vaccinated.
And I think that that's an interesting number in the context of the count that at least the state dashboard is reporting with a first dose out of Springfield, because it's about 5,400 in the 12 to 15 range and 3,200 in the 5 to 11 range. So
That have been vaccinated?
That's what it says on the dashboard, yeah.
Okay. Right.
But just to that point, I think that means there are parents that are taking their children to get vaccinated on their own. And these 600, I think, are critical because they may not have had that opportunity if they weren't provided through the schools.
Yes, and parents are also, we're not just vaccinating students. Parents can come in and get vaccinated as well. So it's a comprehensive approach to try and get as many of our residents vaccinated as possible.
Absolutely. Councilor Govan, did you have any questions today?
No, I did not have any questions. I just wanted to hop on and just, you know, again, thank you so much for the good work that you're doing, Commissioner. And as you said, when we are out here, I think this was the second week that we were giving out COVID tests and doing vaccines. Our vaccines aren't really getting given out the way we would like to see them, but we are, you know, doing vaccines between 10 and 2 and 3 and 7 on Thursdays. And at the same time, we're giving out COVID tests. So we're going to do it again this Thursday. I'm hoping that the vaccine clinics will, you know, increase in numbers, especially out here, because we know that, you know, Indian Orchard has the low numbers. So I just want to continue for us to continue working on that.
Very important. And, you know, obviously, we wanted to set up clinics in places where there was a low vaccination rate. That's why we're so appreciative of the Indian Orchard Citizens Council and your leadership, because we want to make sure they're in the community where people can access them. And I am told that we did not get the numbers that we wanted, that we're looking for, but the goal is to do it for 6 weeks and be consistent. And hopefully by individuals understanding that every Thursday you will there'll be a clinic that will start to gain some traction. So it was the first and second one. We've got some time to go. So hopefully it'll pick up.
Yeah, and also we're thinking about, I've spoken to, oh gosh, I forgot her name at the state, the DPH lady, Nina, I wanted her to say her name is.
Yeah, Nina, yep, that's a name.
Nina, so we're actually talking about the possibility of having a pop-up vaccine clinic at the housing complexes that we have out here. We have 2 of them that I would love, to be able to go out there and just encourage people to come out and get vaccinated right where they live. So we're working on that too.
Yeah, and that would be excellent. So hopefully DPH will get that. I actually had a meeting with Nina, Beth Buxton, and Victor Ortiz. And that's a part of your suggestion, and you're asking to have them go there as a part of the discussion. So keep bringing up those kinds of, strategies, because I think they're very important.
Yeah, definitely. Thank you so much.
Thank you, Councilor Govan, and certainly excellent work in Ward 8 and Indian Orchard. So I think, Commissioner, those were my questions for today, unless Councilor Hurst or yourself have anything else you feel we should discuss today. We certainly can move towards adjournment of today. I know this is a different phase of the pandemic. It's been a long, almost 2 years now. And I think that folks are just still very interested in how they can stay safe, and the updated guidance, that continues to evolve as we look at this different phase. But hopefully we're on the downward trajectory from this most recent surge. And as the warmer months come upon us, I'm hoping we'll see continued case counts dropping.
Thank you, Councilor Letterman. I appreciate these meetings and the opportunity to update the council. So thank you.
Mr. Chair, just one final question. Sorry. Commissioner, can you just speak to where we are at with respect to deaths, let's say over the last couple weeks? I mean, I know there have been some high profile deaths as a result of COVID. Just heard of another one yesterday. I didn't get a chance to read the article where it said cases were going down. So I don't know if they highlighted the number of deaths last week or the week prior, but what are you seeing as it relates to deaths from the Omicron variant?
So
here in Springfield.
What I can tell you is that as of November 30th, which is the last data that I had, there were 268 deaths in the city of Springfield since the beginning of the pandemic. What I can do, Councilor Hurst, is go back and take a look at December's data, which was not in my system yet. But I certainly can take a look at them and give you some updated data as far as the deaths are concerned since the Omicron, which would probably take us back to the 1st of November, end of October, 1st of November, actually. So I can tell you how many deaths happened since then. I also will take a look at December's deaths and give you some updated data on those as well.
Okay, and even for the next meeting, it's not a huge deal, but even for the next meeting, if you can.
Okay. Happy
Thank you, Commissioner.
Thank you,
Mr. Chair.
No problem. And I think that information is important as well, because I know there's been, some understanding in the public, or a belief in the public, that Omicron is a more mild variant, and that seems to be true if you're vaccinated. But if you're unvaccinated, or if you have further complicating factors, you still can have very serious impacts, if not fatality. And so I think understanding it, to understand this current state of the pandemic, I think those numbers are important.
Happy to get, I will have those prepared for our next conversation.
Thank you, Commissioner. Thank you to both counselors, and we will certainly reconvene for our regular meeting in 2 weeks' time. And then if there's other topics that come up, we can obviously convene in the interim as well.
Thank you.
All. Have a good rest of your day.
Thank you as well, Mr. Chair, for the Bay State information. I appreciate it, my good man. Thank you.
Thank you.
All right, everybody. Bye-bye.
Bye.